Hello, and welcome to America Then versus Now. This is episode 1, Healthcare. Here's what we'll be talking about today. The first segment is Healthcare Then, where we'll talk about the history of healthcare and health insurance in America. The second segment is the healthcare debate, where we'll talk about the differences between private sector healthcare and government-run healthcare, and why the transition from private to government-run is so difficult. The third segment is Healthcare Now, where we'll talk about the Affordable Care Act and the court battle to eliminate it. The fourth segment is Healthcare in the Future, where we'll go into what's being considered for the future of healthcare and what those options entail. The final segment is a preview of the next episode, which will be on political parties. Stay tuned for that. First, let's define healthcare. Healthcare is the field concerned with the maintenance or restoration of the health of the body or mind, and any of the procedures or methods employed in this field. Essentially what we mean when we say healthcare, then, are the doctors, nurses, hospitals, and equipment that help with people's health. Segment 1 is Healthcare Then. Dr. Elizabeth Rosenthal, editor-in-chief of Kaiser Health News, gives a short and effective history of healthcare. Quote, "The people who founded the Blue Cross Association in Texas nearly a century ago had no idea how their innovation would spin out of control," she says. "They intended it to help the sick, and, in the beginning, it did. 100 years ago, medical treatments were basic, cheap, and not terribly effective. Often run by religious charities, hospitals were places where people mostly went to die. Care, such as it was delivered at dispensaries for minimal fees." Rosenthal also says that Blue Cross Plan's goal was not to make money, but to protect patient savings and keep hospitals afloat. Blue Cross plans were not for-profit. Between 1940 and 1955, the number of Americans with health insurance skyrocketed from 10% to over 60%. At this point in our history, Blue Cross and Blue Shield was a force for good across America. But this new demand for health insurance created a massive business opportunity and an emerging market with other motivations besides the force for good that was the Blue Cross and Blue Shield. Millions of people wanted access to health care and expected their employers to provide insurance so that they could have it. For-profit insurance companies moved in, disregarding the Blues' charitable mission. They accepted only younger, healthier patients on whom they could make a profit. They charged different rates depending on factors like age, as they had long done with life insurance. And they produced different types of policies for different amounts of money, which provided different levels of protection. By the 1990s, the Blues were losing money at an extremely fast rate. Amid pressure from state directors, Blue Cross and Blue Shield relented and allowed its member plans to become for-profit companies. So what does this descent toward its profit tell us? Well, we can see why healthcare is so hotly debated today. Non-profit advocates want healthcare to be free or inexpensive in order to benefit individuals, while for-profit advocates want care to cost more, therefore benefiting groups and companies. We can also see a decline in the increase of life expectancy in the United States. Statista explains that medical advancements, fewer wars, and improved living standards have contributed to the near-constant increase in life expectancy over America's history. However, we can see that the rate of change for that increase has gone down drastically. For example, in the 60 years between 1900 and 1960, the life expectancy increased from 48 years to 70 years. However, in the last 60 years, from 1960 to 2020, life expectancy has only increased from 70 years to 78 years, a marked decrease in the rate of change from the previous 60 years. Segment 2 is the healthcare debate. There are two starkly different sides of this debate. The first side is the accessibility side, and the second is the economy side. Senator Bernie Sanders, an advocate for the accessibility side and author of the Medicare for All Act of 2019, said that, quote, "Healthcare in America must be a right, not a privilege." On the other hand, President Donald Trump, an advocate for the economy side, said that he wants people to be well taken care of, but he also wants healthcare that we can afford as a country. There are 5 major parts to the debate over healthcare. First, quality. This is essentially talking about how effective the healthcare is. Accessibility advocates would say that quality of healthcare could improve under a government-run program, while economy advocates say that quality would decline. This depends on many factors, like physician motivation, hospital closures, and wait times for care, which are all variables for providing healthcare. Second, accessibility. Advocates for accessibility would argue that because only 92% of Americans had health insurance in 2019, a government-run program would expand that access to everyone. On the flip side, economy advocates would say that accessibility would decline because the system would be overloaded. Third, quantity. Accessibility advocates say that there aren't enough hospitals for everyone, especially in rural America, that this has been exacerbated by the COVID-19 pandemic, and that a government-run program would help rural hospitals. Economy advocates argue that hospitals would close under this program because of failed federal funding and a shortage of doctors. Fourth is quickness. Accessibility advocates claim that wait times for care are already too long in the United States, and that a government-run system would fix this problem. However, economy advocates point to Canada and their relatively long wait times as evidence that a similar program in the United States would create disastrous consequences. The final point of argument is cost. Accessibility advocates say that a government-run program would save money for the average American by simplifying administrative costs, redirecting existing funding from Medicare and Medicaid, and implementing a minimal wealth tax to pay for the rest. Economy advocates say that this wealth tax would be disastrous for the economy and that it would cost more than projections say, leading to increased burdens on families and providers. Disagreements on these 5 points have led accessibility advocates and economy advocates to propose multiple plans, from adhering to the status quo, also known as what we have now, to moving towards one of several different options. We'll cover those in the next 2 segments. Segment 3 is Healthcare Now. In 2008, 43.5 million Americans did not have access to health insurance at any point in the year. In 2019, that number was 26.1 million. So what happened between 2008 and 2019 that caused the number of uninsured Americans to decrease so dramatically? Well, during that time, the number of people with public health care through programs like Medicare and Medicaid increased by 32.8 million. This increase in coverage in public plans more than covers that gap. The big health reform bill of the last decade was the Affordable Care Act, or ACA. The ACA is a federal law signed by President Barack Obama in March 2010 that aimed to expand access to insurance, increase consumer protections, emphasize prevention, improve quality and system performance, expand the health workforce, and slow rising healthcare costs. 2 of the primary goals of the ACA were to protect people with pre-existing conditions and to increase employer-provided insurance. The implementation of the ACA prevented insurance companies from denying coverage to people with pre-existing conditions and required employers to cover their workers or pay penalties, with some exceptions for small businesses. A third goal was expanding eligibility to non-elderly adults with incomes at or below 138% of the federal poverty level, which is the same as an income of $27,310 annually for a family of 3 in 2014. Though this Medicaid expansion was supposed to be a national one, a 2012 Supreme Court decision essentially made it optional for states, and as of January 2016, 19 states had not adopted the expansion. The ACA should have been a success in increasing access to healthcare. Repeated court decisions and repealing legislation have crippled its effectiveness, and it still has decreased the number of people that are uninsured. Many privately insured people that don't qualify for Medicaid are still hurting for money, KFF reported. They say that spending even small amounts on healthcare can crowd out other necessities or require low-income families to go further into debt. Low-income families with Medicaid spend only 1% of their yearly budget on healthcare, while low-income families without Medicaid spend 6% of their yearly budget on it. This kind of spending often causes low-income families to go further into debt or to crowd out necessities other than healthcare, like food, transportation, housing, and other significant costs. On to our 4th segment, healthcare in the future. The U.S. is at a crossroads for healthcare. Progressives and Democrats support expanding public healthcare coverage in one of 2 different ways, and conservatives and Republicans support reducing public healthcare coverage or keeping the status quo. The first option is, well, a public option. Presidential candidate Joe Biden has proposed a public option and even branded it as Biden Care. This would include passing a new Affordable Care Act, as the old one has been, as he says, broken down into a skeleton of its former self. This new version would include a public option for anyone that wanted it. A public option is a government-run health insurance agency that would compete with private companies and provide healthcare at a cheaper rate to anyone who wishes to buy in. Biden Care would also attempt to reduce surprise billing, wherein health insurance companies send bills to individuals and households that were not expecting another medical bill. This would apply to both private insurance and the public option provider. The second option is Medicare for All. First authored in the Senate by Senator Bernie Sanders, Medicare for All attempts to eliminate private insurance and replace it with a solely public system, known as a single-payer system. This would make 13 categories of healthcare free for everyone, eliminate private insurance to maximize its intended positive impact, and save money, as a recent Yale study has shown that we would decrease healthcare expenditure nationally by 13% every year under Medicare for All. The final option is keeping the status quo. Conservatives and economy advocates push for this option, which would keep private insurance as the major healthcare provider and costs more for the average individual than a public option. They say that this would cost less overall than Medicare for All. In addition, Medicare and Medicaid would stay. These government programs cover senior citizens and low-income individuals and households. Thank you for watching this video. You can hit the subscribe button for more videos like this, and we'll see you next time on America Then versus Now. The next video will be on political parties.